Namaste, I am Dr. Sonali Gautam. I am a practicing consultant gastroenterologist at Airoli Center for Digestion. Today we are going to discuss about GERD, that is GERD, Gastro-esophageal reflux disease. So basically there is a reflux. Normally our stomach, that is gastric, produces around 1 to 2 liters of acid per day for digestion, which is very important for all of us because acid usually breaks down protein and food products, and those broken down products are absorbed by the intestine. So in one way, acid production by the stomach is helpful for digestion. But some patients, these acid gets reflux, that is, it usually comes up into the esophagus, that is a food pipe, and irritates the esophagus, which can give rise to symptoms like burning in the throat, burning in the chest, sour regurgitation, that is khata pani muh mein aana, night cough, that is these patients when they sleep because of reflux they get cough. Because of cough at night their sleep is disturbed and they feel fatigued and drowsy in the daytime. So these are basically symptoms of reflux. So what is GERD? So GERD is gastroesophageal reflux. So normally there is a sphincter, there is a muscle between the food pipe and the stomach which prevents the reflux. That means it's a one-way door. Food can go down but it cannot come up. In GERD patients, these muscle between the food pipe and the stomach becomes weak. So the food and water and acid content in the stomach usually doesn't come up because of muscle sphincter between the food pipe and the stomach. But in GERD patient, this becomes weak and the food enters into the food pipe and irritates the throat. And these patients have a problem in swallowing, burning sensation, pain in the chest, pain in the throat, cough, they feel sour in their teeth, their sleep is disturbed. And how does it happen? Why this sphincter becomes weak? So GERD starts with our lifestyle. More the fat around the abdomen, more is the stretching on the stomach, and more is opening of the sphincter. So these patients usually we see are obese, they don't exercise, they have very unhealthy eating patterns, they have very high calorie, high density foods. So all these are the risk factors for GERD. So it starts with our lifestyle. So what is the treatment? So treatment also starts with our lifestyle. So these patients strictly has to reduce their weight, daily 40 minutes of brisk walk, completely cutting down of all high calorie foods like anything which comes in packet form, bread, pav, biscuit, khari, toast, farsan, anything which is in bottled form, Eno, soda, Limca, Sprite, cola, anything which is in covered form, chocolate, coffee, avoiding these type of foods, daily walk, weight loss, having meals at least 2 hours prior to sleeping. That means if you sleep at 11 p.m., you should ideally have your last meal at 9 p.m. So these are small changes in the lifestyle which is going to help on long-term basis. But for short-term basis, for immediate relief, you have to ask your doctor. So usually we advise two main things. That is a medicine which reduces the acid and second molecule which pushes the food down. So these two molecules are added by your doctor, and one syrup is given which is known as Gaviscon, Instaraft. There are many names. So it forms a layer between the food pipe and the stomach. It is usually taken at bedtime. So these are all medicine prescribed on prescription by the doctor to help you to cross these symptoms. Till that time you have to make lifestyle changes which will reduce your weight, reduce the pulling of the sphincter, and on a long-term basis it can help you in reducing the symptoms. Now, what is the role of endoscopy? So any patient who has these symptoms more than 5 years, or any patient who has been taking pantoprazole, PPI for more than 5 years, these patients should undergo endoscopy because the acid which goes up into the esophagus for long term can damage the lining of the esophagus, and in these patients there is high risk of having Barrett's esophagus, which is a type of cancer. So any patients who is having these symptoms for more than 5 years, So kindly consult your doctor so that you can go ahead with an endoscopy procedure where we put a camera and examine the lining of the food pipe. Here we discuss about GERD, GERD, gastroesophageal reflux disease. For more information or further management, you can contact us on the number given below. Thank you.